Actually, it's not about me anymore, it's about the person hearing what I'm saying. And actually, I think I've moved beyond the coming out bit, and actually, it's about them coming in.
A range of health and social care providers and organisations providing services to older and old people across Shropshire, Telford and Wrekin are signed up to the Embrace Covenant. This is a commitment to follow 5 pledges and requires them to implement practical actions to ensure their organisation and the services they provide are inclusive of the lives, experiences and needs of LGBT+ people in later life. Here, these organisations share the work that they've been doing, and Sand illustrates how this can relate to the different sections of the national framework for knowledge, skills and values for working affirmatively with LGBTQ+ people in later life, developed by Skills for Care.
We put mandatory training in across all our care professionals, and then we expanded our induction programme to all staff, which included SAND training material. We've got 2 trained facilitators that can train across all our 30 offices. And then we looked at how we do things. So we reviewed and changed the way that we undertook care consultations, what language we used and how we approached them. And then we put in a set of guidance and training for all the care professionals that do our care consultations. We set up a steering group that is made up of franchise partners, care professionals and registered care managers. And we meet every month to talk about where we're going, what we need to change, relook at all our policies and our action plans. And some of our officers have taken part in Pride events this year. We've still got to improve our communication, and our registered managers are absolutely key to this. So we now have a registered manager's bulletin and a registered manager's surgery. We want more people to be on our steering group, so they have different voices, so we can continue to grow and support our franchise partners across the country. I've got to say I'm in a really privileged position, because in Shropshire, we can change what 30 offices do across the country. So we put things in place, we do the training and then we roll it out to 30 offices. And we've done this in 18 months. And if I'm really honest, I couldn't have done it without the help from SAND and signing the covenant, because the covenant gave me a clear direction of where I needed to be and what I needed to do.
We've looked at that first contact, so when somebody phones and asks about wanting a loved one to come into the home or to look around, that we're talking about partners, not necessarily husbands and wives, that we're not making assumptions about people from that very sort of first contact. And you know, we don't always get that right, but we are improving on doing those things. We've introduced a leaflet explaining about LGBTQ+, our work with SAND, about the covenant, the things that we're doing. That's become part of a welcome pack that we give to people when they first come into the home. It shows a willingness to want to have those conversations. So if people want to share their life choices, then they can feel open to being able to do that.
The biggest challenge we've had is changing old attitudes and trying to get rid of old terminology. And it's been fine, really. People think it's quite a struggle, and it hasn't been at all. People have been very accepting.
It's important that care homes are inclusive and so everyone is free and comfortable in where they live. Nobody should feel uncomfortable or not be able to be who they want to be. Times have changed from where we were 40, 50 years ago, and really some of these people are people that have paved the way for this generation, so it's important that they be celebrated too.
I think primary care should, and hopefully always is, a welcoming place for all. At my surgery, I hope we've got it right, but there's always room for improvement. So there's almost a constant state of flux, really, because we always feel we could do better. I'm sure you'll hear today, or perhaps already know, that LGBT+ patients often suffer from poorer health outcomes. They may experience more domestic and sexual violence, they can have a higher incidence of mental health and homelessness, and a lot more. So it's really important that we bear that in mind when we're seeing our clients. As with all our patients, in what we call minority groups, for example, patients with learning disabilities, perhaps veterans. We seek to encourage an inclusive culture and develop services and approaches that best help those people. And we treat everyone as an individual. So when we were approached by SAND, it was an obvious decision to sign up to their covenant so that we could work collaboratively and we might learn more and we could improve and better understand what we actually need to do and how best to go about doing that.
We launched the LGBT employee network really to champion LGBT issues, raise awareness and support staff, and that's been really well received. And as part of that, we've also got an allies network, and if they do sign up to be an ally, they get issued with these rainbow lanyards that they can wear, which is a really visible sign to show other members of staff and also residents that we come in contact with their support for the LGBT community. So that's gone down really well. We've held a number of awareness days on our retirement housing schemes, and actually one involved residents watching the Pride film, and it went down really, really well amongst residents. It was really excellently received.
All of us have the absolute right to age safely and without fear of discrimination, and to be openly who we are, not who society thinks that we should be.